Hi, I'm Dr. Brian Parsley. I am an orthopedic surgeon, and I'd be happy to welcome you into my practice. Any patients who undergo a hip or knee replacement need to realize that this is a major operation. It's not a minor condition that's being treated. You will be admitted into the hospital and you'll undergo a involved major procedure. They'll put you to sleep, you'll have your procedure performed, and then the recovery phase will take some time. Your energy levels will be decreased as a result of the insult that you had, but we'll work very hard to try to get you back on your feet and active again as soon as possible after your surgery. So how do you prepare to undergo this type of operation? Number one, we need to really work very hard on your general physical health, and that is performing your exercises before you even undergo a hip or a knee replacement. In doing so, you're going to maximize your physical capacity before you have this major operation. As a result, you're going to have a better capacity to start, and when you finish your operation, you're not going to drop down as low. And once we start on your therapy after your operation, you're going to be able to build back up to a higher capacity even faster. This is your responsibility. I want you to make sure that you're doing that in advance, because I'm going to ask you to do it right afterwards as well. This is a shared opportunity to get well. I need you to do your part, just like you want me to do mine. And I know you want me to do an A+ job, and I want you to do an A+ job too. In addition to your physical health, we need to make sure that your medical health is good. Number two is, if you have problems with your dental work or cavities or things that need to be addressed, have them addressed well in advance of your operation. Anytime you have any problems with your dental issues, that infection can get into your bloodstream and can affect your artificial joint at any time in the future as well. So get ahead of that before your operation and stay ahead of it through your life. Other areas of major concern is certainly your cardiovascular system, your hypertension, your diabetes, your weight or obesity, and any other medical conditions that affect you, like your liver function or your kidney function. All of these need to be optimized before you have a major operation. Obesity is a problem in this country that is growing exponentially, and it has a trickle-down effect on everything else in your medical arena. Obesity is on the rise. It's the fastest growing diagnosis in healthcare. Has a direct relationship to hypertension, has a direct relationship to the astronomical increase in type 2 diabetes, as well as an 18-fold increase in osteoarthritis of your hip and knee, directly related to obesity, and you're in charge of that. So to address that, you have a trickle-out effect of benefit on all these other areas. And I ask you to look at yourself seriously and see if there's something that you can do to help improve this in advance. Diabetes is another area that needs special focus. Diabetes is a major cause of infection after total joint arthroplasty. If you're a diabetic, I want you to really become aware of your disease and look at it and figure out ways to control it to the best of your ability and get the best experts to help you as well. Well-controlled diabetes still has a 1.5% to 2% increased risk of infection when you have a hip or knee replacement. And what is well-controlled diabetes? You need to have your fasting blood sugar less than 130 every morning. You need to have your A1C less than 7. In fact, in my office, I prefer that you have your A1C less than 6.5. If it's greater than 7, your risk of infection is 10 times normal because your diabetes is out of control and your system has a very difficult time fighting off any infections. If you don't know what your A1C is or what A1C means, then I really want you to learn about your disease, because you should know. And if you don't, going forward, that's unfortunate, because your health is at risk. Diabetes will kill you. Hypertension also needs to be under control. We are going to ask you to be involved in a number of exercises to recover from this operation. And having your hypertension and your cardiovascular system in the best of shape possible is to your advantage. And there's all kinds of ways that you can do that, but working closely with your medical doctor is key. I hope you get healthy, and I hope you stay healthy as we prepare for your surgery.